Hi, my name is Stephen McGee and I'm the author of Curing Electromagnetic Hypersensitivity. And we're going to talk about a subject of curing electromagnetic hypersensitivity, and that is root canals. So many people have realized that the root canals are actually giving them problems. So the only way to find out for sure if your root canal is giving you health problems is to have it removed. And I was fortunate that I only had one of these root canals, and what we're looking at is the pieces that came out of my mouth, and we're going to go through them. So this is the main piece, and you can see it's got the roots, and you can see the gutta percha, the black stuff that goes down into the roots. So that's kind of one half of the tooth. The other half of the tooth actually broke up, and there's these pieces right here. But for hypersensitivity purposes, this was what I knew was there, and this is a metal cap. So the whole interior of this cap is a piece of metal, and then it gets encrusted with porcelain to make it look like a natural tooth. So that was the top cover for the root canal, and I was concerned that it was actually acting as an antenna system. I had a very horrendous encounter with the utility meter reading car that has a big antenna system on the roof. I had a week of pretty severe sickness afterwards, which was quite classic radio frequency sickness. So I was suspicious of this, and this is why I got it removed. But the thing I didn't realize was that this was in there also. I didn't even know it was there. So this is a metal rod. Looks like it's a piece of stainless steel from what I can tell. And that was actually placed into one of the roots of the teeth. And I was a little bit shocked to actually see that come out, because I wasn't expecting it. And the problem is, when you have two pieces of dissimilar metal in your mouth, is that they start creating strange effects. I'm going to talk about a couple of those effects. And one of them is you can get arcing that occurs between this piece of metal and this piece of metal when you're in very high-powered electromagnetic fields. And I was an electrical and electronics engineer, and I was going into very high-powered electromagnetic fields with this particular tooth in my mouth. And when arcing starts occurring between two different pieces of metal, it gives off radio frequencies, and it's occurring very close to your brain. So it can bring on some very weird brain activity, and it's very, very undesirable. So if you've got one of these in your mouth, you need to be very, very careful with where you're going, and you should be avoiding going into very high-powered electromagnetic fields. And the other thing that's going on with two pieces of dissimilar metals in your mouth is that strange battery effects start occurring. So the ingredients of batteries are essentially two different metals, an electrolyte, and the body is an electrolyte, the liquid system of the body, and you put two pieces of metal that are very different into the body, they start creating the battery effect. So when you've got two pieces of metal inside a tooth, then you may actually find that it's actually functioning as a battery. And one of the things that I found was every time I would touch this with my tongue, I would actually be able to feel a voltage coming off it. And as you can see, there's a little bit of the metal exposed, so that's why I could touch with my tongue. Every time I did it, I actually sensed a voltage on my tongue, quite similar to what you feel when you put a 9-volt battery on your tongue. So that was the other reason why I decided to get it removed. I'm very happy that I did get it removed, because I didn't show any withdrawal symptoms in the first day of having it removed, but the second, third and fourth day were marked by a very, very large and severe headache, which kind of indicated that I went through some level of withdrawal from this tooth. So that's my root canal for you. I hope you enjoyed the presentation, and I wish you the very best of health. Thank you.